Yo, it's your boy number 5. You know who it is, the masters of medical comedy. If you don't like the show, change the channel. I'm coming at you with episode 5 of Diaries of Doctor Number 5. This is going to be a two-part series. Two-part. First part. I don't really feel like I'm appropriately dressed. Let me see what I can do about this situation. Yep, that's what I'm talking about. So if you haven't guessed it already, we're going back to my surgical days, my first year as a junior doctor. And back in those days, actually, when I was all scrubbed out like this, I used to have a gold chain with my wedding ring on it, just dangling right there, because when you look this good, boy, you better come with a warning. So let me tell you about the surgical take. This is a concept that I didn't understand at all until I started working. In general surgery, you have a number of consultants, and the way patients are distributed to those consultants is through the surgical take, okay? So every week, one consultant will be the lead guy, and during that week, any new surgical cases that come in will get taken onto their list, okay? And once that week is over, you've got pretty much the set of patients that you're going to be working with for the next few weeks, trying to get them sorted and get them discharged safely home. So for example, if it was the week 1 was the Sasapu week, then week 2 would be someone else, 3 someone else, 4 someone else, and by week 5, it would be Sasapu's week again. So, you had about a month to sort out those patients that came on during the week that you were on take. The toughest thing about the surgical take as a junior was the fact that you were working Monday to Friday, just balls to the wall, taking on, kind of all these new patients, etc., etc. Then you work the weekend as well, where you would cover every patient in surgery under whichever consultant they were under. So you'd cover everyone, and then the week after you'd be doing normal days as well. So you had a stretch there of 12 days where you were pretty tired towards the end. If you watch my videos, you already know what the surgical team is, but since it's been about 5 years since I did that video, I'm going to reintroduce you all. At the top of the chain, you had Mr. Sasapu, consultant surgeon, then Mr. Bota, the registrar, who's a trainee surgeon. After that, you've got Rhiannon, the very capable, competent FY2, who could have quite comfortably been a surgical registrar herself. She was very, very knowledgeable. And then, bottom of the chain was your boy number 5, fresh out of medical school and in the surgical theatre. Speaking of fresh, how am I looking right now? Pretty damn good. If any of your bald men like me like to keep that shaved head look, then check out my man Glyn at SMP Solutions. I see you, baby. I see you. I told you I'd shout you out. Anyway, check him out. Right, shall we get on with business? As any good juniors, you should always turn up to work before your boss arrives. So Rhiannon and I would usually be already in place on the ward. Rhiannon practically done half the ward round at this point anyway. And next up usually walked in Mr. Bota, who was an Eastern European man, very hardworking, always very pleasant to talk to. And he'd come in and say, good morning to everyone. Good morning, Mr. Bota. And then by that time, our lead nurse for that ward would come and greet us as well. And finally, in comes, good morning, the big man is here. Bota, let's begin. Rhiannon, you're doing very well. Nalai, wake up. Before the round even began, Rhiannon's bleeper went off. Bleep, 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 bleep. For any of you young Thundercats who don't know what a bleep is, it's a small electronic device that we used to have, which sent you a little tweet, and you could reply to the tweet by the number that it was coming from. In hospital, it was invaluable because you could find the nearest phone, pick it up, and speak to whoever it was. For Rhiannon, in this case, it was usually coming from A&E, who were calling about a new potential patient who was coming on to the take. So Rhiannon would have to go down to A&E and assess these patients. So at this point, in terms of doctors, we were now down to 3. So there we were. The first patient we saw was a middle-aged lady with pain in her tummy. Scans showed that it could be a gallbladder stone. She was in agony. Sasapu went up to her. "Good morning, I'm Mr. Sasapu. Can I have a feel of your stomach?" Put his hand gently on the patient's abdomen. She was wincing in pain. He looked up at Bota. "Bota, I think we're going to have to take this one to theatre. Nilay, call the anaesthetist. Book her in as an emergency." Yep, okay, one emergency, booking in for theatre. And the ward round went on like that. Some people needed more investigation, some people needed bloods to be done, some people we would just watch and wait, other people booked into theatre. So it kind of worked like that. And by the end of the ward round, we had seen every surgical patient in the hospital, including the kids over in pediatrics. So it was a pretty big job. And then you had to actually get to work after that. So at the end of this mammoth, gargantuan ward round, Rhiannon had come back and forth 3 or 4 times and was down in A&E assessing another 2 patients. That was going to be her day pretty much until she finished. Mr. Bota had been sent to theatre to start on that gallbladder patient that we saw at the beginning. And Mr. Sasapu looked at me and said, "Nilay, are you going to be okay with the jobs?" "Yes, sir, I'll do my best, and, yeah. Do your best. Very good. Listen, the best learning is in theatre, so why don't you come? You'll really enjoy it. You might even learn something." "Sir, if I get opportunity." "Nilay, make sure you're there." So I kind of politely agreed, scratching my head, thinking, how the heck are we going to be able to manage all the jobs that are on the ward that we've made, plus the new jobs that are going to come from, the things that the nurses ask, etc., etc. Anyway, I managed to get down into theatre where Mr. Bota had already started work on this gallbladder patient. He was well underway, and I was scrubbed up. Be right back. Scrubbed up, ready to go, ready to learn. If you ask me, any operation is a complex procedure. And that's why it's important in a hospital to be able to have a registrar who can learn from the consultant and have a consultant that can guide them through as well. Also, you have to remember that these are keyhole operations, so you're performing everything by watching a television screen. So it adds to the difficulty of whatever you're doing. And on this occasion, Mr. Bota was doing a great job. He'd already started before the consultant had come in and was confidently negotiating the gallbladder. And suddenly, he ran into a little bit of difficulty. Sasapu was standing next to him, watching, observing intently. "Bota, talk to me." "Yes, just a bit tricky. The gallbladder is not playing today." "Not playing, eh? What are you thinking?" "Well, if I try to maybe if I try to move it a bit." "Bota, be careful. You're going to rupture the gallbladder." "I think I can do." "Bota, stop. Stand back. This is a Sasapu gallbladder now." Sasapu made a new incision into the patient, introduced a new angle to approach the gallbladder. Bota soaked it all up. Sasapu turned to him and said, "Bota, you must always have a plan B. Always have a plan B. Ain't a lie." "Huh? Plan B? Yes, very good, sir. Yes, very good." "Nilay, go out and get some fresh air. You're looking tired. I think you've seen enough." "Okay, sir. Thank you." So I removed my surgical gown and made my way to the small lounge area that we had in theatre, waiting for Mbota and Sasapu to finish up their surgery. All this time there was jobs building up on the wards. And as I waited in the lounge, I could hear the voice of one of the consultants, who definitely wasn't working today, chatting away with what sounded like no one else. And in walked Mr. Nawaz, alongside Mr. Sasapu, who'd clearly finished up. Mr. Nawaz was a passionate character. He was a wonderful man to listen to. I could listen to him all day long. He had amazing stories to tell, and everything he spoke with so much passion. He walked in with Sasapu. Kishore, I'm tired of these things, you know. All these things, I'm tired of these things, you know. Kishore, I'm so tired of these things, you know. Kishore, I'm tired of listening to these things, you know. I'm so tired of these things. Clearly he was complaining about something, I didn't know what. But Sasapu listened. Nawaz Saab, you need to relax. Why don't we go for a coffee? Immediately I saw Mr. Nawaz's face look calm. Sasapu looked at me. Nalai, coffee. Huh? Oh, yes, okay. I was good at coffee. Speaking of coffee, now's a good time to take a break. So let's call this the end of part 1, and depending on your feedback, I'll think about how quickly we put part 2 out. Until then, peace.